Hey guys, welcome back to our channel. Today's video is about a topic that all of us must be aware of: cardiac arrest, symptoms, causes, and treatments. Cardiac arrest can happen to anyone, anywhere, and at any time, so it's essential to know how to recognize the symptoms, what causes it, and how to treat it. So, what is cardiac arrest? Simply put, cardiac arrest is when your heart suddenly stops beating. It's a life-threatening condition that requires immediate medical attention. When your heart stops beating, blood stops flowing to the brain and other vital organs, causing a person to lose consciousness and, if not treated immediately, can even lead to death. Therefore, it's crucial to recognize the symptoms of cardiac arrest and seek medical attention as soon as possible. In some cases, there may be no symptoms at all before a cardiac arrest happens. However, some people might experience fatigue, dizziness, shortness of breath, nausea, chest pain, heart palpitations, and loss of consciousness before a cardiac arrest occurs. Remember, these symptoms can be life-threatening, so if you or someone you know is experiencing these symptoms, you must get immediate medical attention. For a better understanding, let's discuss the causes of cardiac arrest. Cardiac arrest can be caused by a heart attack, electrical problems in the heart, a thickened heart muscle, or a structural abnormality in the heart. Some other risk factors that may cause a cardiac arrest are drug abuse, potassium or magnesium deficiency, obesity, and smoking. People with no risk factors can also experience cardiac arrest, but it's more common in older men than women. Now, let's talk about the difference between a heart attack and cardiac arrest. Although some people use both terms interchangeably, they are two different heart conditions. A heart attack occurs when there's a blockage in the arteries that stop blood flow to the heart, while a cardiac arrest happens when the heart stops beating suddenly. When a heart attack occurs, it can increase the risk of a cardiac arrest because it can alter electrical signals in the heart. Suppose someone experiences cardiac arrest. In that case, they need immediate treatment to increase the flow of oxygen-rich blood to the organs. The first line of treatment is usually cardiopulmonary resuscitation, CPR, which involves compressing the chest to increase blood flow to the organs. CPR can temporarily treat cardiac arrest until more advanced emergency treatment is available. Once emergency medical service personnel arrives, they will use a machine called a defibrillator to send an electric shock to the heart to help it regain function and beat normally. This treatment should be used immediately to save the person's life and reduce further organ damage from oxygen and blood deprivation. Defibrillators are used by trained first responders. Some public areas may have an automated external defibrillator, AED, that can detect harmful arrhythmias and deliver an electric shock to the heart. Today, we're talking about a topic that we all must know about: cardiac arrest, symptoms, causes, and treatments. In this video, we'll discuss how to recognize the symptoms, what causes it, and how to treat it. Cardiac arrest can happen suddenly without any warning signs, but some people might experience fatigue, dizziness, shortness of breath, nausea, chest pain, heart palpitations, and loss of consciousness before it happens. Cardiac arrest can be caused by a heart attack, thickened heart muscle, a structural abnormality in the heart, electrical problems in the heart, drug abuse, potassium or magnesium deficiency, obesity, and smoking. Heart attack and cardiac arrest are two different heart conditions. A heart attack is when there's a blockage in the arteries that stop blood flow to the heart, while a cardiac arrest happens when the heart stops beating suddenly. If someone experiences cardiac arrest, they need immediate treatment to increase the flow of oxygen-rich blood to the organs. The first line of treatment is usually cardiopulmonary resuscitation, CPR, which involves compressing the chest to increase blood flow to the organs. A defibrillator is used by trained first responders to send a shock to the heart, which helps it regain function and beat normally.